So last week we went over the superficial muscles on the cat. Had the latissimus dorsi, the spinotrapezius, acromiotrapezius, all the muscles of the head and neck. We had the ventral view, looking at the xiphi humerales, the pectoralis minor, major, the pecto antebrachialis, that epitrochlearis, as well as the muscles in the neck. We then went laterally to the leg to look at things like the sartorius, the tensor fascia embedded in the tensor fascia lata, the biceps femoris, as well as the gluteal muscles, the semimembranosus and the semitendinosus in the back. Now, this week, we're going to go deeper into the cat. And we're going to start at the same place we started last week, on that latissimus dorsi, going anteriorly. All that work that you spent clearing your specimen, making sure that it was nice and easily seen. Remember how we talked about how there were two sides to the animal that you could work from. On the uglier side, you can start your work. The first thing to do is to take your scissors and cut through the meat of the latissimus dorsi. So lift up the muscle and begin cutting anterior and towards the dorsal portion to expose the musculature that's underneath. We'll get to that part later. For now, we'll continue our incisions up through the spinotrapezius. And when we get to this part, it's best to go ahead and turn your cat over. Pushing the elbows together spreads out the scapula from one another, and we can continue our cut that was started at the spinotrapezius, and moving very superficially with the scissors angled up, we can cut through the skin and other connective tissue that was holding this together to start getting into the deeper muscles of the neck. Just like last week, there's going to be a lot of clearing away of connective tissue. Again, that wispy material can be removed and broken to separate the acromiotrapezius and other musculature from the shoulder blade. Expose the muscles of the neck, the splenius muscle, and start gently tearing away the connective tissue between the shoulder blades to expose muscles such as the rhomboideus here. Now remember, you have to learn where these muscles originate and insert. And with the rhomboideus muscles, they insert on this posterior margin of the scapula. And they insert at the posterior margin of the scapula, and they insert around the vertebral column. The rhomboideus is actually an amalgamation of multiple muscles, but you only have to know it as the rhomboideus. The single muscle that you do need to know from this is the most anterior, and it's often easily separated from everything else. As you clear away that connective tissue, you'll begin to see this muscle that runs from that back portion of the shoulder blade, of the scapula, all the way up to the top of the head. This is the rhomboideus capitis. The way that I tend to remember this is that it goes all the way to the top of the head, just like a cap would. It sits at the cap. Deep to that is the neck muscle, the splenius. And continuing to clear this stuff out, we can see two layers of musculature on the back portion, or the medial portion of the scapula. The subscapularis muscle, which is in that subscapular fossa. Remember, you can use your skeletal knowledge to help inform what's going on within the cat. The splenius muscle is this major portion along the neck. The other muscle that you can see is deep here. This is deeper than the rhomboideus, and if you clear away the connective tissue, it can almost make its own flap. This is the serratus ventralis. Notice with that name, it sounds weird because we're looking at it from the dorsal portion. On the ventral part of it, it is serrated, and we'll get to that now. This is what a near complete dissection looks like for you to be able to find the remainder of the terms in this region of the cat that you need to see. Closing this up and flipping the cat over to the ventral view, we're going to make our next incision. Again, you probably have a pretty side and an ugly side of what you did for the pectoral muscles. We're going to take the ugly side, preferably this would be the cat's left side. Lift up the xiphi humerales and the pectoralis muscles, and again, begin cutting through the middle of those muscles, keeping your scissors angled up so that you're not cutting into those deeper muscles that you'll need to know for this section. Cut all the way up past the pectoantebrachialis and reflect those muscles back to expose the underarm area. Again, feel free to get anything out of your way that's inhibiting your view, most of which is going to be this connective tissue layer. You want these muscles to be a nice deep red color for viewing. Again, nerves such as this one can be cut away. There's nothing that you need to know for the rest of the semester. One thing that I did not cut as I moved anteriorly along this is these deeper arteries and veins. Try to keep those intact. You'll need to know those later in the semester. As we start to clear away the connective tissue, the muscles begin to become more apparent, as they tend to do without all the connective tissue covering them. Now remember how I mentioned in the dorsal view that you could see the serratus ventralis muscle? You can see it here as well. This is the shoulder blade, and this is the subscapularis. The subscapularis is there. That serratus ventralis is here. I'll put my probe on top of it in the dorsal view, and when we open up the arm, you can see the probe coming out that way. Cut through some more of those connective tissue layers to make it more obvious, but it's this entire sling here. It is serratus ventralis because it is serrated on the ventral view. If you think about a serrated knife, it has those sharp edges going through it. It's not smooth. And as you start to clear away the fat and the connective tissue, you'll begin to see that this muscle has little serrations throughout it. As you dissect, make sure that these are quite obvious so it's easier for you to remember it and it's easier for your GTAs to pin the structures on the organism. Remember, a good dissection makes for an easy exam.